and welcome to Business Success in a Virtual World podcast, a resource of information for businesses to understand and embrace the innovative power of XR, VR, and AR. Each episode, we attempt to summarize what's new in this growing industry and highlight actual case studies of how these technologies are advancing success in business and enterprise. I'm Tim Beharon, Chairman of Creative Strategies, and each episode I'm joined by Barton Goldenberg, President of ISM Inc. Together, we help our listeners navigate the ever-growing mountain of information and technologies impacting virtual worlds, the metaverse, augmented reality, spatial computing, etc. In addition to all the information presented in each episode, additional information can be found on our resource website, in which you'll discover news, products, and most significantly, over 175 actual case studies of businesses utilizing these inventive technologies. That website is found at www.ismguide.com. The XR Metaverse resource link is on that site. There you'll discover field service examples, training, customer service, manufacturing, and much, much more. It's a fast-growing and complex area destined to impact your business. Let us help you figure out the best strategies. Now, on to the next episode. In our session this week, we're going to deviate a little bit, even though this is actually a case study, but we're going to go into the world of medical, and more specifically, surgery. I have had the chance of actually using a robotic surgery machine some years ago. I was brought into this facility that allowed me to test using one of these ways to do surgery on actually it was a appendectomy. Thankfully, it was not a real patient because I would have killed him. But the skill set I began to understand about using just robotics was fascinating. Well, in this particular case study in discussion on surgery in the medical field, we're going to be talking about using both VR and AR as a part of the surgical process. And I got to tell you, this one is amazing. So, Barton, to you.
Thanks, Tim. So as Tim alluded to, today's podcast focuses on the incredible growth of XR, which of course is AR, VR, and MR, technologies in surgery, including neurosurgery, cardiac surgery, spinal surgery, sinus surgery, and a few others that we'll be mentioning. Now, while XR technology is being widely applied in many industries, from, for example, gaming to retail, each industry derives unique benefit from the technology. But I would suggest few, if any, derive the benefit of helping to save lives and improve surgical outcomes. Not that long ago, doctors learned how to perform surgery in a physical hospital conference room or in a physical laboratory using human cadavers. Extraordinary note-taking abilities and memorization were essential in those days. But over the past 5 years, technology has radically altered the way surgeons train and perform surgeries. Today, surgeons can virtually learn the latest surgical techniques by putting on a VR headset and watching a simulation, or by putting on AR glasses to learn how to perform a medical surgical navigation procedure. Surgeons today wear AR headsets as they operate, allowing them to see information such as patient imagery without ever turning away from the critical task of focusing on the operation. With the addition of cameras and AI software, surgeons and their AR AI solutions can see what is going on inside a patient, process vast amounts of data to interpret it, and return on-the-fly diagnoses or procedural suggestions right into the AR headset. So let me give you a couple of notable AR surgical navigation applications. So neurosurgery, and we'll go into this in a little more detail later. AR technology has revolutionized neurosurgery procedures by providing surgeons with a precise visualization and navigation capability. AR technology allows for accurate planning and execution of these delicate procedures, such as tumor removal, spinal surgeries, and deep brain simulations. Second notable AR surgical area is orthopedic surgery. And here, AR-based surgical navigation has been particularly beneficial in orthopedic procedures, such as joint replacement or spine surgeries. Here, surgeons can precisely align implants, accurately track bone structures, and ensure optimal placement, resulting in improved functional outcomes and reduced complications. The third area where AR is impacting surgery is on minimally invasive surgery. So here, AR technology has significantly advanced the field of this minimally invasive surgery by providing real-time guidance and visualization that's less invasive and more accurate than previous used robotic-assisted navigation that you talked about, Tim, earlier on. Using AR, surgeons can navigate complex anatomical structures with enhanced precision, reducing the complications and speeding up patient recovery. And you can learn more about this minimal invasive surgery in our August 2023 Mayo Clinic case study, where it's amazing what they've been able to do to determine and move through skin and cell and vessels to determine what they really have to do as to whether invasive surgery is required. Now, I sat back and I asked this question. What is driving the interest in AR-assisted surgery? And for me, and I'll explain why as I move through the case, the answer is a multitude of measurable benefits that are really moving the needle for both the doctors as well as the patients. So let's look at some of these benefits. One, it can improve surgical planning. So by visualizing the patient anatomy before the procedure, surgeons can identify potential risks and create more accurate surgical plans. Number two benefit, enhanced accuracy. So AR technology allows a surgeon literally to see through the patient's skin and tissues, helping them to navigate complex anatomical structures more precisely. Number three, reduced surgical complications. So with better visualizations and guidance, the surgeons can then minimize the damage to healthy tissues, reducing the risk of complications and improving patient outcomes. Number four, shorter operation times. The improved efficiency and accuracy provided by these AR technology can help reduce the actual duration of the surgery, and that's in part because the surgeon can keep focused on the tumor rather than moving their head back and forth from the camera and the monitor showing details and then moving back into the tumor. And number five, faster recovery times. So minimally invasive procedures made possible by AR technology often result in quick patient recoveries and reduced post-operative pain. So you sit back and you think about this. Improved surgical planning, enhanced accuracy, reduced surgical complications, shorter operation times, faster recovery times. Like, who wouldn't want that if you were the doctor or the patient? And that, Tim, is what's driving this incredible surge in AR-assisted and really XR-assisted surgical interventions. But I want to share.
Can I
Go
just
ahead.
add one thing there?
Absolutely.
And you may bring that up, but in the example that you and I studied here, he also used that experience to show the patient how and what he was going to do, so that the patient had an actual visual perspective of what the tumor looked like. In this case, it was a brain tumor. It showed the actual tumor in green, I think it was. And then he actually showed through a simulation of how he would go in and actually remove it. So the visualization to the patient made a huge difference from the standpoint of the patient's comfort level, because he now knew he had a more visual approach to what the doctor was actually going to do to the person.
That's 100% accurate. In fact, It's a part of the story of Dr. Robert Lewis, who's a neurosurgeon practicing at the HOAG, I think it's Hoag Hospital in Newport Beach, California. And Dr. Lewis was a fellow speaker with us, Tim, in 2021 at the Augmented World Expo that takes place annually in California and now in Europe and in Asia. I was absolutely fascinated by Dr. Lewis's presentation. It was titled Solving Problems in Medicine with Advanced Visualization and Immersive Therapeutics. And in his presentation, to reinforce what you talked about, Tim, which you can watch on YouTube, he addresses the 3 common problems associated with traditional surgery systems and how XR-driven systems are now solving the problems. Problem number 1, and you've already made a note of this, there's never been a way to practice an operation. Now, Dr. Lewis said that prior to XR technology, surgeons used to just scroll through old school information to plan the operation. But now with XR technology, surgeons can practice an operation. He showed the case of a man with a brain tumor. Using traditional surgical systems, Dr. Lewis was planning to remove the tumor by going in just above the eyebrow. After using XR technology, including some 3D graphical overlays of the tumor, Dr. Lewis changed his approach, decided because the tumor hooks coming out of the tumor were connected to other parts of the brain, it made better sense to go in from the side of the head to ensure he could see and remove the entire tumor, which he did with great success. He spoke about Mount Sinai Hospital surgeons rehearsing surgery for specific patients using XR technology. Now listen to this carefully because this blew my mind, that led to a change in the surgical plan a quarter of the time. If you think about that differently, almost 25% of the time, surgeons would have performed the wrong operation for a particular patient had the surgeon not simulated the operation using XR technologies prior to the surgery. Wow. Problem number 2 that Dr. Lewis talked about, and this is what you said as well, Tim. Patients do not understand medical imaging. So Dr. Lewis said that prior to XR technology, he would show traditional medical images, like, for example, an MRI, to a patient and their family and spend hours and hours trying to explain where the brain tumor was in the image, how he intended to remove it, what the cover was going to be like, etc. But the average patient does not understand that medical images and got lost in the conversation. Yet when Dr. Lewis showed imaging from the XR technology system, the patient understood much better what was going on, and Dr. Lewis was able to take away the fear of the unknown within the operation, which is actually quite important. Problem number 3 that he mentioned, traditional navigation requires the surgeon to divert the attention, or his attention, or her attention, away from the operative field. So Dr. Lewis spoke about the importance of staying focused on the tumor during the operation. With traditional medical technology, he would have been obliged to look at the microscope on a separate monitor, reconstruct the image from this monitor in his mind, then go back to the operation. This meaningfully slows down the operation, but with XR technology, using his AR glasses that work as a microscope magnifying the tumor 10 times, and the AR surgical navigation color-coding the tumor, so he could more easily identify the tumor without diverting his attention from the operative field, Dr. Lewis was able to perform a more precise operation that had a better patient outcome. Here's how Dr. Lewis summed up his presentation. Just like we make pilots practice for hours on a simulator prior to letting them fly, surgeons should do the exact same thing using VR simulations. He said, I would prefer to make mistakes in the VR model safely rather than in the patient themselves. I also use VR, he said, to enhance the ability for the patient to understand the surgical plan. And then I switched to AR during the operation to view an accurate overlay of the tumor that improves my visualization and performance during the surgery. I think it's an amazing story. So who then are the key players driving the growth for XR surgical navigation systems? And I want to make a point here. These are, I call them XR surgical navigation systems, because the XR doesn't do the surgery. What they do is they help the surgeon navigate the surgery, and it's very important what it does. So this is an interesting perspective. There's a mix of manufacturers active in the XR surgical space. While most global brands are active, my take, Tim, is that the smaller VC-backed XR companies who are flexible and nimble and hungry will be the real drivers in advancing the application of XR technology to surgery. And I'm going to give you 3 examples of big companies and 1 example of one of those smaller VC-backed companies, just for learning purposes. So Medtronics, everybody knows about them, based out of Minnesota. Among other areas, Medtronics focuses on brain surgery. They have integrated real-time AR technology with their Stealth Station S8 surgical platform, and that's used to tackle tumors and aneurysms and vessel malfunctions and other conditions. Their platform gives neurosurgeons a way to test different approaches virtually before they enter the operating room, which we've talked about, as well as to provide a live 3D rendering laid on top of the surgical site during the brain procedure to help the surgeon perform more precise and successful operation. This is exactly what Dr. Lewis did. Stryker, another great global company, and among other areas, Stryker focuses on sinus surgery technology and have developed their targeted guided surgical system. Everybody has a system that uses AR hardware, including an endoscopic camera, coupled with AR software. This marriage of high-tech hardware and software adds a guided path for surgical tools to pass through. Think about that. A guided path for surgical tools to pass through. Accuracy. The third big one is Abbott. Again, we all know them. Amongst other areas, Abbott focuses on cardiac surgery. And in 2021, Abbott, and this is 4 years ago now, 3 years ago now, Abbott launched a global optical coherent tomography, what they call an OTC, VR training program for cardiologists to increase their expertise about Abbott's OTC imaging technology and to improve the outcomes of patients needing a stent to open up a clogged artery. VR training, and this is what Abbott did, improved the cath lab learning engagement by 45% and the knowledge retention by 72%. We've done lots of podcasts on the value and the importance of training, VR training, and this is just another example. The numbers are in line with everything else. And the last one that I want to mention is that VC-backed company. It's called Augmetics. It's out of Chicago. It focuses uniquely on spinal surgery. And see, this is what I talked about. Abbott and Stryker and Medtronics are in lots of different technologies. This company, Augmetics, just spinal surgery. Their FDA-cleared X-Vision spinal system includes a headset for real-time spinal anatomy projection, allows for 3D visualization of the spinal anatomy during the surgery. It's designed as if the surgeon had X-ray vision into the patient's anatomy to accurately navigate instruments and implants while looking directly at the patient instead of looking at this monitor or the screen to the side. Now, the first 2 spinal surgeries using Augmetics XR technology took place in my neck of the woods in 2020 at the Johns Hopkins University in Baltimore, Maryland. In 2023, which is about 3.5 years later, the 5,000th spinal surgery using the AR technology of Augmetics took place at the Hospital for Specialized Surgery in New York City. And I was not surprised to learn that Augmetics recently closed an $82.5 million Series D funding round. So that's why I made my comment about I think that the smaller VC-backed companies will be the real drivers advancing the application of XR technology. Now, when you have new technologies, and Tim, you know this better than I do, you have key challenges because new technology brings new challenges. And XR has shown a great promise improving the precision and outcomes of surgery, but it also comes with its own set of new challenges. So for example, discomfort and wearability. So historically, VR, AR headsets have been cumbersome to wear for an extended period of time. You're going to probably, you can tell me about the Apple Vision Pro and why that maybe addresses the discomfort and wearability issue. Number 2, cost. So AR technology used for surgical navigation requires advanced imaging capabilities inside the operating room and expensive for the hardware, the software, the training, and for personnel. For now, XR technology used by surgical navigation or for surgical navigation, they're still affordable for most major hospitals. Plus, AR surgical navigation may also have implicit costs such as human error. It might save on these implicit costs, such as human error, surgical error, potential lawsuits resulting from malpractice. There's a whole bunch of that goes back to the benefits. Number 3 key challenge: surgeon training and familiarization. Surgeons need to be proficient in XR systems to reap their full benefit. Medical schools, manufacturers, hospitals need to provide training programs, which they do, as well as ongoing support to ensure that surgeons are comfortable and skilled in using XR technology effectively. And closely connected is the newness of XR technology. Even though FDA-approved systems exist, many surgeons are wary of these systems. They look at them like there's some science fiction. And the industry needs to push the awareness of this groundbreaking technology, again, that is FDA-approved and available for use today. Some closing comments, Tim. The future of XR technology in surgery holds tremendous potential to further revolutionize both healthcare as well as patient outcomes in 2 major areas: enhanced precision and personalization. And by that I mean XR technology will continue to advance, offering even greater precision and personalized guidance for surgeons, real-time intraoperative imaging, patient-specific anatomical overlays, and predictive analysis will further optimize surgical decision-making and outcomes. And the second area for where we're going to see major growth is surgical education and training. So XR surgical navigation systems, particularly VR in this case, will play a vital role in medical education, allowing students and trainees to observe and learn from surgical procedures in an immersive and interactive manner. The technology can help bridge the gap between theory and practice, enhancing the skill and proficiency of further surgeons. Additionally, XR technology has the potential to aid in telemedics, or telemedicine as it may be called, enabling remote surgeons to assist in complex procedures from anywhere in the world. And again, I go back to the Mayo Clinic. All incoming doctors have to be trained using VR technology on all of the labs that they work within, as well as all the technology and tools. So, this will all happen out of the medical schools, and the companies that are selling these products are really obliged to do great training. The incredible impact of XR technology in surgery is still in its infancy. The integration of innovative IT with XR technology applications in surgery will surely blossom over the next years, and will deliver new surgical systems, new approaches, and even better patient outcomes. We sure are living in exciting times, Tim. Back to you.
Yeah, it is fascinating. After I was watching the video of the doctor performing this particular surgery, I remember thinking, and I think I sent you a note back on this, is that if I ever needed brain surgery, this is the guy I'd want to do it, because, the idea that he can practice on the surgery beforehand instead of on the patient, very comforting to me as a patient, right? Because you want him to be 100% accurate when he actually does the operation. And in this particular case, that's what happens. I've actually seen other scenarios where VR is being used, especially for training heart surgeons, and a lot of things in that particular category. And there's no question that the technology of especially VR and AR is going to have a big impact on the medical field. But the adoption cycle, and you mentioned one thing, which was cost. And you said the bigger hospitals and big medical systems, it's not as big an issue. But do you have a kind of a prediction of how fast this can actually dramatically change the way surgery is done? I mean, obviously it's an evolutionary process, but when you have this level of success, I would think the motivation would be there even faster.
I think it's going to be from 2 sides again. One is the surgeon or the doctor, and the other is the patient. So you've already alluded, I'll just take the patient side first. You said, if I ever have a brain surgery, I'm going to see that doctor at Newport Beach. because you felt comfortable with this. And I want to tell you, I was looking at the augmetics system and in the offering and on the spinal side. And one of the biggest challenges is with older people when they do spinal surgery and cervical procedures is the quality of the bone structure. And what this augmetics system allows you to do is, and it said it like X-ray, putting, having glasses that have X-rays, is it allows you to look at the quality of the bone. So when you go to put the screw in to, let's just say, hold a piece that you put in on the spine, you can anchor the screw effectively. And so you're not poking and trying and breaking a little bit of this or whatever. You're being much more accurate, which is why the operation takes much less time and is much more successful. Again, they did their 5,000th spinal surgery using this tool. And you just think about it. I mean, we joke, but we are the old guys that eventually might need spinal surgery. And you can bet your bottom dollar, I'm going to go to one of those hospitals that has that exact technology. So from the patient side, there's going to be a huge push to get hospitals to use this type of technology. So that's one side. The other side are the doctors. I mean, when Dr. Lewis talked to us and others, there's a wonderful physician, William Levin from the University of Pennsylvania. He did another great case study. It's on at AWE and it's also on YouTube. He concluded that he really didn't want to do any more medical interventions without the patient relaxed, calm as a result of the VR technology to jump onto a ship in Bora Bora and relax and understand what they're doing and bring them into the operating room. He does proton imaging, which is quite unique. It's the biggest center in the United States at the University of Pennsylvania. And he allows patients to actually wear the headset and they're relaxing while this proton is bombarding their body to figure out what's going on. And he just said he finds the results are much better as a result of using these technologies. So the doctors, whether it's Dr. Lewis with, 20, in his case, it was 24% of the time he changes his approach to the operation as a result of the VR review and then the using the AR glasses. And so when doctors start to talk to each other about this and the cases, 5,000, you start to get a real traction and a legacy of why this technology is important. So you got patients pushing and you got doctors pushing. Now, all you got to do is come up with money. And here, I can't predict how quickly patients are going to, or Medicare will cover more expenses, or private insurance will cover more expenses, or philanthropic people will give, more wings or in hospitals to that particular type of surgery, or glasses or goggles or whatever. So I don't know, Tim. All I can say is we're on a trajectory, and I did see some charts as I did my research for this podcast that show a fairly steep slope of the adoption of this technology by hospitals and medical centers in this country and also overseas. But I don't have a precise figure. I can imagine we're 2024 now. I can imagine by 2026, 30 to 50% are going to be using in neurosurgery, cardiac and training and spinal. 30 to 50% will use it by 2030, 50 to 80% will use it by 2035, 80 to 100% will use it. I mean, it's the only way to do it. It's the right way to do it.
Yeah, and I'm fascinated because the technology is getting better, which is going to make it even more capable to handle these type of things. In this particular case with Dr. Lewis, I think he used HoloLens and forgot the other one that was part of it. But you can imagine if he has, especially the new Apple Vision Pro as a potential tool that has even more precise pixelization and imaging capabilities in the headset itself, how that could potentially impact, and expand how he visually understands what's going on.
So hang on, go. I wanted to push that a little bit. So remember, one of the issues was wearability and comfort. And I want you to talk a little bit about Apple Vision Pro's comfort and wearability. And then you've made the point of increased pixelization means you get a more precise view of what's going on in the tumor, in the heart, in the vessel, et cetera. But talk a little bit more about that.
Well, you really got to have high resolution imaging for understanding the final process. And they have that from an external camera. But now, if with the Vision Pro, you're going to have the playback on it with much higher level visualization, because the pixelization will be more accurate. And then as far as comfortability, Apple has really done a really good job of customizing how easy it is to wear. When I tried it and played with it, it amazingly fit perfectly just the way it was. But for others, there's all different ways that you can actually customize it, including custom glasses. If you have prescription glasses, can even be put in there. But there's no
And I
question.
think, by the way, Tim, hang on. I think what you said is Apple has placed such importance on getting the headset to fit and be comfortable that they're not allowing you to simply mail order an Apple Vision Pro. You have to go into an Apple store, and be fit so that it by the Apple expert, and there's actual specialists within the Apple store that have been trained in Cupertino on how to make sure that the whole headset fits the right way, etc. Is that correct?
That's correct. Yeah. The first generation of this headset, you will actually have to go to the store and get it custom fit. But that speaks to the comfortability issue, right? That in the end, and like I said, in my particular case, when I put the headset on, it just fit perfectly. It was surprising. But my only point, and we're basically running out of time, but there's no question that XR and AR technology is going to revolutionize the surgical process, and probably many other elements of medical diagnosis as well. But as I pointed out, if I was going to have brain surgery, I would surely like that particular doctor to be able to test his procedure in VR as opposed to on me. And with that, folks, we'll end our time today. Thank you for joining us, and we look forward to you being with us next time.
Thanks, Tim.
For more information on this and other case studies, please check out the website www.ismguide.com and click the link for XR Metaverse Resource Center. We look forward to you joining us next time on another episode of Business Success in a Virtual World.